Now I want to talk about the cranial nerves. Remember, these cranial nerves were 12 pairs of nerves that came out of the ventral surface of the brain. We number them with Roman numerals according to the position, beginning with the most anterior or rostral nerve, and then going lateral and then all the way to the posterior for number 12. The name is usually related to its function. Over here we've got cranial nerve 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. I expect you to learn all the cranial nerves, their name, their number, and their basic function. To do this, there's lots of great mnemonics on the internet. The one that I learned in school was "On old Olympus towering tops, a fat virgin German viewed some hops." So if we look at cranial nerve number 1, it's the olfactory, and then the optic, and then the oculomotor, and then the trochlear, and then the trigeminal, and the abducens, and so on, all the way down to 11, which I learned is the spinal accessory nerve. Today we've dropped the spinal and we're just calling it the accessory, and there you have the mnemonic. There's lots of mnemonics out there. Some of them are a bit dirty, but if that's how you remember, then that's fine with me. So let's talk about all of these. Olfaction is the sense of smell. So cranial nerve number 1 allows you to smell things. It starts off in the brain, comes down in what we call the olfactory bulb, which then sends the true part of the olfactory nerve into the top of the nasal passageway through the cribriform plate of the ethmoid bone. When cranial nerve number 1 is stimulated, then the olfactory nuclei of the brain perceive a smell. Damage to this area is going to cause a problem called anosmia, which is a lack of smell. Often this will come from head trauma, where you can see those little delicate nerve endings that are projecting underneath the olfactory bulb will get sheared off. Cranial nerve number 2 is the optic nerve. The optic nerve runs from the back of the eyes, called the retina, and decussates partially at the optic chiasma, and then runs internally in what we call the optic tract. Cranial nerve number 3 is the ocular motor. It does most of the movements of the eye. Here's a lateral view of an eyeball, right eye. We've got 4 rectus muscles in each of the cardinal directions. There's a superior rectus, an inferior rectus, a medial, and a lateral rectus. And then there are 2 oblique muscles. There's the inferior oblique on the bottom and the superior oblique on the top. And you'll notice that the superior oblique runs through this little tiny loop of connective tissue called the trochlea. Trochlea means pulley in Latin. And as these muscles contract, the eyeball itself doesn't change its relative position within the orbit. Instead, the eyeball will spin on its axis and point in different directions. And that's what cranial nerve number 3 does, is it contracts those muscles and spins the eyeball around to direct your gaze. Cranial nerve number 4 is called the trochlear. Hey, it might have something to do with the trochlea. It's going to power that superior oblique muscle, which sends its tendinous loop through the trochlea and then kind of wraps around the top of the eye from medial to lateral. We're going to skip 5 for a second and go right to 6, which is the abducens. To abduct, remember, is to kidnap something or move it away from the body. So the abducens controls the lateral rectus muscle, which then directs your gaze laterally. So going back to the trochlear, when the superior oblique muscle contracts, it's going to rotate the eye a little bit, but it's going to direct your gaze inferior and lateral. And this is going to help you look for short things coming up from behind. If you turn your head a little bit to the side and move your eyeballs and use your peripheral vision, you're only using one of your trochlear nerves. The other eyeball is looking medial. So we're not using the trochlear nerve in that eye. If we go to the abducens, that lateral rectus muscle is going to direct your gaze straight laterally. And so that's to check for taller things that might be chasing you. So which cranial nerves direct the gaze? That's 3, 4, and 6. Moving on to cranial nerve number 5, it's called the trigeminal. Tri is 3, Gemini are twins. And the trigeminal is a fairly large nerve. It branches out of the trigeminal ganglion and then goes to 3 big spots in your face. It's going to exit through your skull at the superior orbital foramina, the inferior orbital foramina, and the mental foramen. Cranial nerve number 5 is interesting in that it does both sensory and motor functions. It does sensation all over the face, And then specifically, it has motor functions for the muscles of mastication, which are, mastication is chewing. The facial nerve goes to all the muscles of facial expression so that you can move your face around and grimace or smile at somebody. And it also has a sensory function where it does taste from the anterior 2/3 of the tongue. Number 8 is the vestibular cochlear nerve. A vestibule is an entranceway, a cochlea is a snail, and if we look at the inner ear, we have a vestibule and a snail, so it's the vestibular cochlear nerve. It is a common nerve until it gets into the inner ear, and then it splits into the vestibular part and the cochlear part. Remember, cochlea means snail, and you can see the cochlea curling around a little bony pillar in the middle. And then the entranceway here is the vestibule. The cochlea functions in just hearing. The vestibular portion, on the other hand, is used in balance and equilibrium. Number 9 is the glossopharyngeal nerve. Glossus is tongue, and the pharynx is the muscular tube in the back of the throat, so it's going to go to both of those places. It's going to do taste from the posterior 1/3 of the tongue, and it's going to do mostly motor to the pharyngeal area. Cranial number 10 is the vagus nerve. Vagus means the wanderer in Latin. It drops down through holes in the skull, and it goes almost everywhere in the body. It connects to the heart and the lungs and the pancreas and the stomach and the liver and the intestines and the spleen. It kind of goes everywhere. It carries what we call parasympathetic motor output. Number 11 is the accessory, or as I learned it, the spinal accessory nerve. This is probably the most boring of the cranial nerves. It just goes to a few of the muscles in your neck, like the sternocleidomastoid and a little bit of the trapezius. And then finally, number 12 is the hypoglossal. Hypo is below, glossus, of course, was tongue, and so it helps to move your tongue around. If you've ever been to the doctor, you may have had a cranial nerve scan. And what they'll do is they'll go ahead and check the cranial nerves one by one. It's extremely inexpensive. It's very quick, and it's not very diagnostic, but it does give a physician kind of a general idea on how a patient's brain is doing, how well it's functioning. Cranial nerve number 1, the olfactory, is not typically checked during an examination unless a patient is complaining of loss of smell or taste. Cranial number 2, vision, is checked with an eye chart. You can also check it along with cranial nerve number 3 with what is called the pupillary reflex. Cranial nerve number 2 is carrying sensory information into the brain, and then cranial nerve number 3, in addition to moving the extraocular muscles of the eye, are also going to control the iris of the eye, which controls how large the pupil is, or the hole in the front of your eye that lets light into the back of your eye. So as you shine light into the pupil, cranial nerve number 2, the optic, is taking that information to the back of the brain, and then a reflex in the back of the brain is kicking out information on cranial nerve number 3 to tell that iris muscle to contract so that the light isn't as bright. So you can check 2 and 3 at the same time, and they do this when they shine a little light into your pupils. If you have somebody hold their head still and hold a finger or a pen or something in front of them and say, watch my pen here, but don't move your head, and then you draw the letter H in space in front of them, then you can test all the movements of the eye. So that's 3, 4, and 6, all tested at the same time. Cranial number 5, the trigeminal, has a couple different ways to test that one. You can gently touch their forehead and their cheeks and their chin to see if they can feel stuff on the same side. Or what you can do is just put your fingers alongside your jaw and ask them to clench their jaw, and you should feel those muscles of mastication, specifically the masseter muscle, bulge as it contracts. Cranial nerve number 7 is the muscles of facial expression. This one's not usually overtly checked unless you're suspecting some kind of stroke damage, but just in interacting with the patient, asking them how their day was, and the little bit of small talk they do, they're actually watching your face to see if all those muscles are working correctly. Number 8, as you tell the patient, hey, we're just going to be down in room 3, just to your left there, they're actually watching you as you walk down the hallway to see if you're having any problems with coordination and balance. So that's part of 8. And then the hearing part, the cochlear branch, you can test just by talking to somebody and seeing if they can hear a normal, quiet conversation. Or you can do what's called a finger rub, where you just take your fingers, move them up next to your ear, and just rub them together. You should be able to hear that. I'll be quiet for a second so you can try that in one of your ears. So if you don't have any hearing issues, you should be able to hear that without any problem. 9, 10, and 12 are all checked at the same time with a tongue depressor. You have them stick out their tongue and say, ah. So remember, the tongue is controlled by the hypoglossal. You could take the tongue depressor, you put it in there, ask them to say, ah. The uvula should lift straight up. That's a function of cranial nerve 10. And then you take your tongue depressor and you whack them in the side of the throat as you pull it out and try to initiate the gag reflex. Yes, that's deliberate. What's going on is cranial nerve number 9 is going to pick up the sensory aspect of that. And then cranial nerve 10 is going to cause you to have the gag reflex. And that's all of them except for number 11. For number 11, you could just simply ask somebody to shrug their shoulders, and you could push down to make sure that they're equally strong. Not very expensive. All it takes is a pen light and a tongue depressor, and you can have a really good idea of how all of those cranial nerves are working.